Hello, I am Dr. Subhash Jangir from Fortis Hospital, Gurgaon. Today we'll discuss about the difference between the conventional and robotic knee replacement surgery. Now in a conventional technique, when we cut the bone or we remove the cartilage to put an implant, we take these cuts by certain jigs which we do by ourselves. The surgeon does it by himself. Now in robotic technique there are two advantages. One is that when we take these cuts are precise. We are taking these cuts with the help of robot. So robot has an arm which is in the hands of the surgeon and it doesn't allow the surgeon to go here and there. So the cuts are absolutely precise. So these cuts will be absolutely like a machine finish, both on the thigh bone and on the leg bone. Now another big advantage of robot is that this knee has to be balanced properly so that it doesn't toggle here and there. So when you operate on the knee after the knee replacement surgery, the knee should not be opening on either side. That should not happen. With robot, you are able to see that this gap between the two bones in extension and flexion is absolutely accurate. And that is the beauty of this robot, that it gives you that objective numbers, that this gap is 10 millimeter on the inner side and 10 millimeter on the outer side. If you know that figure accurately, the knee will last longer, the pain will be much less after the surgery, the blood loss will be less, and the recovery is much faster. And we are pretty sure that with this new implant which are there nowadays, they will last for almost 25 years plus.